states: weak legs, leg cramps, fatigue while walking, or even difficulty standing for longer than a few minutes. These are signs your body is screaming for help. Whether you're in your 30s or pushing past 60, leg weakness doesn't just come from aging. It's often a nutritional issue. People from the United States, Canada, the United Kingdom, and Australia are loading up on the wrong supplements while ignoring the real vitamins that actually build strength, balance, and energy in the legs. If you're struggling to climb stairs, if your legs burn or tremble after just a walk around the block, this could be one of the most serious signs of vitamin deficiencies, ruining your muscle and nerve function from the inside out. Vitamin D should be the very first one on your radar. And here's why. Without enough of it, your legs simply won't hold you up the way they should. It's not just about bones. This vitamin directly supports muscle contraction and nerve signaling. Thousands of people in the United States are being diagnosed with normal aging, when in reality, they're walking around severely deficient in vitamin D. You need vitamin D3, not D2. The D2 form, often prescribed or found in fortified foods, doesn't absorb nearly as well, and it won't give you the neuromuscular support you need. What most doctors in Canada and even in the United Kingdom forget to mention is that vitamin D deficiency also mimics multiple sclerosis, fibromyalgia, and chronic fatigue syndrome. People get scared thinking they have a progressive disease when sometimes all they need is a targeted dose of D3 combined with K2 for calcium regulation. The best time to take D3 is in the morning, with fat because it's fat-soluble. If your legs feel heavy, rubbery, or weak, if you've noticed they cramp at night or shake under pressure, your D levels could be dangerously low, and just supplementing could change your entire physical experience. Vitamin B12 is another absolutely crucial nutrient if you feel numbness, tingling, or pins and needles in your legs. In the United States, millions are suffering silent B12 deficiency without even knowing it, especially people over 50, vegetarians, vegans, or those with digestive issues like GERD, celiac, or Crohn's. Injections of B12 are often needed when absorption through the stomach is compromised. Your legs rely on your spinal cord and peripheral nerves to function properly, and without enough B12, your nerves literally start to deteriorate. In the United Kingdom and Canada, this is often mistaken for diabetic neuropathy, but in truth, it can happen to people without diabetes at all. It's a neurotoxic deficiency, and early symptoms can be as small as muscle twitching or clumsiness. The best form is methylcobalamin, not cyanocobalamin. Methylcobalamin is already in the active form your body uses, especially in the nervous system. If you're tripping over your feet, losing balance, or feeling like your legs fall asleep often, B12 could be one of the most powerful game changers. Magnesium is deeply involved in every contraction your legs make. Without enough magnesium, the calcium in your muscles stays elevated, causing stiffness, cramping, or locking of the muscles. In the United States, surveys show that nearly 50% of the population is not getting enough magnesium, and yet, it's one of the easiest minerals to supplement. In Australia and Canada, leg cramps at night are a top complaint in older adults, and doctors often just recommend stretching or hydration. That's not enough. Magnesium is responsible for allowing muscles to relax after contracting. If you have restless legs, if your calves twitch or your thighs feel like they're buzzing, it might not be a neurological disorder, it might be magnesium deficiency. The best forms for muscle health are magnesium glycinate, malate, or taurate, not oxide or citrate, which can irritate your gut. Athletes in the United Kingdom use magnesium baths or topical sprays, but for chronic weakness, oral supplementation with 400 to 600 millihours daily is often what restores balance. The emotional impact of muscle tension in the legs, waking up at night in pain, unable to walk without tightening or needing to sit every few minutes, can be exhausting and even depressing. Magnesium could be the hidden answer. Vitamin E plays a lesser-known but massive role in leg strength, especially when it comes to circulation. This vitamin is a fat-soluble antioxidant that helps blood vessels stay flexible and open, which is crucial for delivering oxygen to your leg muscles. Poor circulation causes leg fatigue, varicose veins, and a heavy-legged feeling that no amount of rest seems to fix. In the United States, many people over 40 begin experiencing peripheral artery disease symptoms and assume it's just aging. Vitamin E, specifically in the tocotrienol form, not the synthetic alpha-tocopherol found in cheap multivitamins, has been shown in some studies to reduce oxidative stress in blood vessels and increase muscle oxygenation. That's a critical factor when your legs feel like bricks every time you move. Canada has recently seen a surge in natural health clinics recommending high-potency tocotrienols for older adults dealing with chronic leg pain and stiffness. One dose won't change things, but consistent use over 8-12 weeks can bring powerful results. Another essential for strong legs is vitamin C, not just for your immune system, but for collagen synthesis. Collagen holds together the tendons, ligaments, and blood vessels that support your lower body strength. Without enough vitamin C, your leg tissues become weak, more injury-prone, and slower to heal. United States diets are filled with processed foods that lack raw nutrients, and vitamin C depletion is more common than most think. People in Australia and the United Kingdom often rely on citrus fruits and leafy greens, but the truth is, if your legs are aching or bruising easily, if you feel like recovery takes forever after standing all day or working out, you need more than just a casual orange slice. Buffered vitamin C with bioflavonoids supports vascular health and prevents capillary fragility, which is often behind that throbbing or pressure you feel in the legs. Vitamin B1, also called thiamine, is another overlooked but absolutely essential nutrient for lower body strength. It's involved in energy production within your muscle cells, and a deficiency can cause pain, burning, weakness, and even nerve damage in the legs. In the United States, people with high-carb diets, alcohol use, or metabolic issues are at high risk of thiamine deficiency, yet symptoms are often ignored or misdiagnosed as fibromyalgia or anxiety. People from Canada and Australia have reported symptoms like leg heaviness, difficulty walking long distances, and unexplained soreness, all linked to low B1. The active form, benfotiamine, crosses into the nervous system and may help reverse early signs of neuropathy. Many Americans with chronic leg pain are taking painkillers when all they might need is a B1 correction. Vitamin K2 is not just for bones. It helps your body move calcium out of soft tissues and into your skeleton where it belongs. Without enough K2, calcium builds up in the arteries of your legs, creating stiffness, tightness, and even early stages of vascular calcification. This often goes unnoticed until a doctor finds poor blood flow or a Doppler scan shows early blockage. In the United States, this is becoming more common due to oversupplementation of calcium without balancing it with K2 and D3. K2, especially the MK7 form, directs calcium away from arteries and keeps your leg muscles supplied with flexible, oxygenated blood flow. People with knee pain, shin discomfort, or unexplained soreness when walking often find relief with this vitamin, though it's barely mentioned in most mainstream health advice. This is just 1/4 of the full breakdown of the top 12 vitamins to strengthen your legs. Shall I continue with the next part? Vitamin B6 is one of the most underestimated vitamins when it comes to maintaining healthy nerves and strong muscles in the legs. If you're feeling tingling, burning, or crawling sensations down your thighs or calves, or if your legs feel like they're not communicating well with your brain, it could be a B6 deficiency or imbalance. In the United States, many people with diabetes or prediabetes experience nerve damage in their legs because of low functional levels of B6. But this happens in non-diabetics too, especially those with poor diet, alcohol use, or long-term use of certain medications like birth control pills or antidepressants. People in the United Kingdom and Australia have also been reporting increased nerve discomfort, and B6 is now being looked at as one of the critical nutrients for neuropathy prevention. But here's the detail nobody talks about. Both too much and too little B6 can cause nerve issues. That's why it's crucial to stay in the optimal range, ideally using the P5P form, pyridoxal 5-phosphate, which is the activated version your body can use immediately. When B6 is in balance, it supports neurotransmitter function, muscle control, and even helps reduce leg tremors or spasms that often get misdiagnosed as anxiety-related symptoms. Vitamin A, while usually associated with vision, plays a crucial role in muscle protein synthesis and immune support, both of which affect your lower body strength more than you might think. People in the United States consuming fast food diets or low-fat processed meals are commonly lacking in vitamin A, especially the active form known as retinol, found in animal products like liver, butter, or egg yolks. Plant-based beta-carotene sources aren't converted efficiently in many individuals, especially in Canada and the United Kingdom, where genetic variations in conversion are more common than people realize. If your legs feel like they don't recover after workouts, or you suffer from frequent infections that leave your muscles inflamed and sore, you might be suffering from a subclinical vitamin A deficiency. This nutrient supports muscle cell regeneration and helps with tissue repair after exercise or physical exertion. In older adults in Australia, low A levels have been connected to muscle wasting and slower wound healing, which deeply affects mobility. For leg strength, this is often an invisible factor that goes ignored for years, until weakness becomes a serious problem. Vitamin B2, or riboflavin, supports energy production right at the mitochondrial level inside your leg muscles. If you feel like your legs are constantly tired, drained of strength, or feel heavy after walking just a short distance, your mitochondria could be starving for B2. In the United States, energy slumps and leg fatigue are often chalked up to age or poor sleep, but the cellular engine in your muscles can't even fire up properly without enough riboflavin. People from Canada and the United Kingdom often deal with unexplained muscle soreness or a dragging leg sensation, especially after activity. This can be an early sign that your body isn't converting food into usable energy efficiently. Athletes in Australia have started increasing riboflavin to prevent leg fatigue during endurance training. The signs of deficiency can show up as cracked lips, eye strain, but also deep leg pain and muscular fatigue that gets dismissed as being out of shape. You can rebuild leg strength if your cells don't have the raw energy to power the movement in the first place. Folate, or vitamin B9, is another crucial nutrient that's often left out of the conversation when it comes to leg health. Without enough folate, the oxygen-carrying capacity of your blood drops, which leads to reduced endurance and slower recovery in your leg muscles. In the United States, folic acid is added to cereals and breads, but this synthetic form isn't always well absorbed, especially in people with MTHFR gene mutations, a condition more common than most realize. Methylfolate, the active form, is what you should be taking if you want real results in oxygen transport and red blood cell health. People in the United Kingdom and Canada are being told their leg weakness is due to aging, when in fact their tissues are starving for oxygen and nutrients. Women especially report leg fatigue and cramping during hormonal shifts like pregnancy or menopause, times when folate demand goes up sharply. If you've ever experienced dizzy legs, shortness of breath while walking, or aching calves after only a few steps, you could be dealing with low folate that's strangling your leg tissues from the inside. Another hidden factor destroying leg strength is a lack of vitamin C's cofactor role in iron absorption. Many people in the United States, especially women, deal with low iron levels that go untreated or misdiagnosed as chronic fatigue, even when the cause is simply poor vitamin C intake. Iron is needed for hemoglobin, which delivers oxygen to your leg muscles during every movement. Without vitamin C, even if you take iron supplements, your body won't absorb it efficiently. Canadians are often surprised to learn that their low energy and leg cramps during colder seasons have to do with seasonal drops in vitamin C-rich produce. Vitamin C also reduces oxidative stress in muscles, which is a big factor in leg soreness after workouts or physical labor. Some people from the United Kingdom working labor-intensive jobs report burning or deep aching in the thighs or hamstrings, symptoms that often improve with high-dose vitamin C and iron pairing. This is why athletes in Australia swear by combining vitamin C with their pre- or post-workout routine, especially for high-endurance sports where leg fatigue is common. Coenzyme Q10, CoQ10, while not a vitamin in the traditional sense, functions like one when it comes to leg strength and muscle energy. This antioxidant is made in the body but declines sharply with age, especially after 40. In the United States, millions of people on statin medications are losing their natural CoQ10 stores, and the result is often muscle weakness, cramping, and leg fatigue that never fully goes away. Statins are known to block the enzyme that helps create CoQ10, and yet most doctors don't mention this unless you ask directly. People in Canada and Australia taking cholesterol meds often complain about leg pain or inability to stand for long, yet this link to CoQ10 is barely acknowledged in routine care. Ubiquinol is the form your body uses best, and people who switch to this active form often report improved endurance, better muscle recovery, and less pain after walking or exercise. CoQ10 lives in your mitochondria, the energy plants of your cells, and when they shut down, your legs become useless machines that just don't fire anymore. It is heartbreaking to watch older adults in the United Kingdom lose mobility while their lab results say everything is normal. CoQ10 could be the key they never got told about. Alpha-lipoic acid is another powerhouse nutrient that directly impacts leg strength, especially for anyone dealing with nerve-related leg pain or weakness. It's technically an antioxidant, not a vitamin, but its role in reversing leg numbness, burning, and nerve damage is so strong that it's prescribed in parts of Europe for neuropathy. In the United States, it's still underutilized despite research showing it can dramatically improve symptoms of diabetic and non-diabetic neuropathy. People who feel stabbing or electric shock sensations in their legs, especially at night or after standing, are often told it's just nerves or that there's nothing to do. But thousands of patients in Canada and the United Kingdom are now reporting real improvement from high-dose alpha-lipoic acid. This nutrient restores mitochondrial function in nerves and muscles, repairs oxidative stress, and even helps regenerate other vitamins like C and E. For people on medications like metformin, which depletes vitamin B12 and worsens nerve function, alpha-lipoic acid becomes even more important. In Australia, many are now combining alpha-lipoic acid with acetyl L-carnitine to support nerve regeneration in the legs after injury or metabolic damage. If your legs feel numb, tingly, weak, or like they're not part of your body, this might be the critical missing piece in your supplement plan. Vitamin B3, or niacin, plays a major role in circulation and energy production, and it could be the reason why your legs are aching or feel ice cold all the time. Poor blood flow in the legs causes that pins and needles sensation, and many people in the United States are dealing with early signs of peripheral vascular disease without even realizing it. Vitamin B3 expands blood vessels, allowing more oxygen and nutrients to reach the lower extremities. But there's a catch. There are multiple forms of niacin. The flush form, nicotinic acid, improves circulation most effectively, but causes skin redness and warmth. The non-flush form, niacinamide, is better tolerated, but doesn't improve blood flow in the same way. People in the United Kingdom often stop niacin due to the flush, unaware that this effect means it's working. Meanwhile, Australians using slow-release niacin are seeing improvements in cold feet, night cramps, and even varicose vein discomfort. In Canada, Many natural health clinics are now using niacin in vascular support programs, especially for older adults with weak or discolored legs. If your legs go cold easily, feel painful in winter, or throb after long walks, it could be due to sluggish circulation that vitamin B3 can fix when dosed correctly.